Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Welcome to today's webinar, and thank you for joining us. My name is Leah Wiggum. I'm the Executive Director of the Paso del Norte Institute for Healthy Living and an Associate Professor at the University of Texas at El Paso. Before we get started, I just want to make some housekeeping announcements. This webinar is being recorded and will be archived along with the presentation slides on our website at msdcenter.org. If you have any questions during the presentation, please enter them into your questions chat box. We will have time for Q&A at the end of the presentation. Today's seminar is being brought to you by Live Smart Texas. This is a statewide coalition that works to connect partners from across Texas who focus on addressing the obesity epidemic, especially in children. Today, I'm pleased to have with us as our speaker for the webinar, Dr. David Lakey, an expert in disease prevention and community health services and infectious disease outbreaks. He is Vice Chancellor for Health Affairs and Chief Medical Officer at the University of Texas System. Formerly, he was the Commissioner for the Department of State Health Services from 2007 to 2015. He is currently also chair of the Partnership for a Healthy Texas. And now I'm happy to turn it over to Dr. Lakey.
Well, good morning, everyone, and thank you, Leah, for the introduction. And as I get started, I want to thank Live Smart Texas for the great work that you guys have been doing to build the science behind obesity and addressing the obesity epidemic that we're all facing here in the state of Texas. What I would like to do today is review what happened this last legislative session, talk about the kind of give you a behind the scenes look at the challenges that occur on the advocacy policy side of addressing obesity, as we try to couple the policy with the science that Live Smart Texas has developed over the last several years. And as I start, I must say that I'm here representing the Partnership for a Healthy Texas, but it really is a team effort. Clayton Travis and other individuals for the partnership really do a lot of the heavy lifting for the partnership. I get to be the spokesperson in certain situations such as today, but it really is a team effort to try to figure out how do we move the policy front forward at the Capitol here in Austin to better address the conditions that we need to address to decrease obesity in the state of Texas. So what I'd like to do is talk a little bit about the why we think this is important, give you some background related to the partnership, how it was put together, its history, why we think the partnership is important. We'll talk then about this legislative session in particular, but also the previous legislative session and the next legislative session, as we try to, again, think long-term about how do we address obesity in the state of Texas. And I would note that this isn't really a thesis. This is more of a real-life discussion of the challenges to address obesity policy in the state of Texas. So why don't we move to the next slide? And as I do that, again, want to thank the partners for hosting this, the folks at UT School of Public Health, the School of Public Health as a whole, but in particular the Austin Regional Campus, the work that you do to support these type of efforts through the support of the Michael and Susan Dell Center for Healthy Living really is important. And as we've tried to combine efforts to form Live Smart Texas to bring the academic voice into the policy arena really is important as we address this chronic issue in the state of Texas. So a little bit about the why we think this is important on the next slide. And I took the next two slides come from a informatic graphic that we provide legislators trying to, again, elevate the issue of obesity. They have a lot of issues that they are struggling with, a lot of challenges that we have here in the state of Texas. And so how do we elevate obesity as a crisis and get their interest in addressing obesity here in the state of Texas? Well, part of it has to do with data and making sure the data is presented in a way that they understand. And so again, this is probably very familiar to the individuals on the phone, but Texas has the 7th highest obesity rate for youth between the ages of 10 and 17, and the 14th highest adult obesity rate in the United States. In fact, over 600,000 Texas youth in that age range between 10 and 17 are obese. And it's an area of significant disparities. And we have the bar graph there at the bottom for 8th graders. And you can see the rates are significantly higher in African Americans and Hispanic individuals than they are in non-Hispanic white individuals. And so again, a very prevalent issue affecting a lot of our kids and an area of significant disparity. And if you look on the bar graph on the right, we're not going in the right direction. The rates of obesity in our 4th graders and 8th graders have gone up. We haven't made progress in the 11th graders. Again, this is looking from 2004 through 2016. We're not going in the right direction, and this will have significant consequences for the state of Texas and for our kids. And so on this next page is a second component of that infographic that we have been providing to legislators of why this is important. It's not a cosmetic issue. It is a real health issue, that obesity is associated with increased lifetime risk for multiple adverse health outcomes: diabetes, heart disease, asthma, high blood pressure, depression. This is very familiar to you, but again, as we try to convey this information, trying to make it very simple in ways that people will understand, that having our kids overweight and obese will have lifetime complications for them, and not just health complications, but also economic costs. That the childhood obesity is extremely costly. It results in extra healthcare costs. A child with obesity has about a $13,000 more increase in their medical costs than a child with normal weight. And we've tried to link educational attainment with obesity. And obesity in childhood is associated with poor educational outcomes, including those that I've listed below. Again, trying to elevate the issue of obesity so it's not just the same story that they've heard, but really make it an important issue for the state of Texas to address. So with that background, let's talk about the legislative session and the 86th legislative session. And we all on this phone right now are very passionate about obesity, but I think sometimes it's important to understand the context in which legislators are making decisions during the short time period that occurs every 2 years to put policy into statute. So a little bit of background on the next slide. One, again, our legislative sessions only occur every 2 years. And during that time period, we have 140 days, a little less than 140 days, for legislation to pass both on the Senate side and the House side, for them to iron out the differences between the bills and for it to get finally passed and sent to the governor's office. And during that time period, this session, almost 8,000 bills were filed. And again, to put things into perspective, out of that almost 8,000 bills, only 1,400 were actually passed. This gives you a success rate of only 18%. And that's how it was designed by our forefathers, foremothers that put the statutes in place. The design is to, set up to kill bills more than to advance policy and to get bills passed. And so we end up with less than 20% of the bills that are filed end up being passed. There is one bill that has to be passed, and that's the budget. And this year, the budget was almost $250 billion. It also, in the budget, gives us opportunity to address health issues, obviously with Medicaid and a variety of other issues, but the budget of Department of State Health Services. And as we talk about some of our strategies this session, sometimes you can't get statutes passed, but you may be able to get a budget rider put in place that can fund the initiatives that we want to move forward. But again, the time is of the essence during the session. A lot of work, a lot of chaos, a lot of bills being killed, a lot of bills being resurrected, and through that, a lot of individuals that are working hard to advance a variety of policy issues in the state of Texas. I think it's also important as we approach legislative sessions to understand the priorities of elected leadership and figure out how there are ways to integrate our desires, our priorities, our passions into those priorities. The key priorities this session, though, were school finance reform, property tax relief, school safety and student mental health, and then Hurricane Harvey. These issues really took up most of the oxygen during the legislative session and were the priorities, again, for the governor, the lieutenant governor, and the speaker. And that, in many ways, defined the legislative session. So on the next slide, we put out the question, in that chaos, how do we elevate obesity as a pressing issue when the lawmakers have so much on their mind? You know, how do we make these important issues urgent? They have other urgent issues. Many of us that take a long-term view of how do we improve health in Texas believe that there are a lot of these issues like obesity that we have to continue to discuss, continue to move forward in a stepwise fashion. But in many ways, they aren't necessarily on the elected leadership on their priority list. And so how do we make sure that we elevate these issues? And I think that's, as we talk about the Partnership for a Healthy Texas, one of the lessons, one of the strategies that we use, in that we try to talk with one voice. And so through this chaos, if we get the philanthropic organizations, the health-related organizations to say, we agree that these are the priority health issues, and for obesity, which the Partnership for a Healthy Texas is the one voice that really speaks on obesity, if we are in alignment with these are the top priorities for us, that's the way that we believe that we can get better leverage and be able to advance the issues during the session. So I'd like to talk a little bit about the Partnership for a Healthy Texas with my academic partners that are here. And you guys are great in putting together the strategies, the evidence, the data. And what the partnership tries to do is to convert that then into policy. And so the partnership, again, is focused on obesity. There are a lot of other health issues, and we work very hand in hand with other voices throughout the state of Texas that are working on tobacco and access to care, et cetera, through other partnerships. But the Partnership for a Healthy Texas really focuses on obesity, so to develop and promote policies that prevent obesity in the state of Texas. So here are the 4 guiding principles that the partnership works under. One is focused on collaboration. We want to encourage collaboration among all interested parties in reducing obesity. And again, if we want to be effective, we need to work together, and we're not being exclusive. Any entity that really wants to work on obesity, we welcome you as a colleague as we try to move forward on obesity in Texas. Second principle is to inform policymakers about the consequences of the disease. Again, trying to elevate the issue of obesity, that it's not cosmetic, that there are real causes here that have real lifelong consequences to the health of the people of Texas, that also has economic costs for the state of Texas and cost to the healthcare system. Many of you are probably familiar with the work that Susan Combs did back in 2009 when she demonstrated that the economic cost to Texas because of obesity was $9 billion in 2009, and it was predicted to be $30 billion by 2030. That type of data, I think, is very important to policymakers as we try to elevate this issue. But we also, in a part of our guiding principle, believe in evidence-based strategies. So we promote evidence-based strategies and do that on multiple levels: the individual level, the family level, and the community level. And then we also try to serve as a resource for individuals and entities, sometimes the news media, that when they're interested in obesity prevention, what will work, what has not been successful, and be that source of trusted information to address obesity in our state. A little bit about the history, and I will, as we go to the next slide, the Partnership for a Healthy Texas, I am currently the chair, but it predates me, obviously. It began in 2009. Many of the folks that are on the phone were probably part of the initial partnership putting it together. I remember very well Michelle Smith, Joel Romo coming to me in 2007 when I was the commissioner of the Texas Department of State Health Services, telling me about how they were working together and wanted to partner with the Department of State Health Services to be a voice for obesity prevention in the state. And I believe that they've been very effective as they have banded together to address this issue. So back in 2006, when they brought research experts together, they developed a statewide policy document called the Texas Obesity Policy Portfolio, which demonstrated evidence-based policy initiatives that they thought would be effective here in the state of Texas. And they were very successful that first session. They were educating lawmakers. They had 6 priorities, and they were able to get 5 of those priorities passed. Again, success rate is usually less than 20% for any individual bill. They were able to get 5 of their 6 legislative priorities passed that session. And because of that success, then the Partnership for Healthy Texas has become a very recognized and valued advocacy voice in the policy arena as we try to fight and end obesity in Texas. Let me go to the next slide and just list some of those historic accomplishments. Again, accomplishments that predate me and my involvement in the partnership. But some of those accomplishments you're probably very familiar with. Passing legislation to require minimum minutes for physical activity in schools, establishing the fitness gram, and then after it was established, a lot of work to make sure that it wasn't eliminated, to make sure that it stayed in place and that they worked with coordinated school health. The partnership has also done significant work with the Texas Department of Agriculture to put nutritional policy in rule rather than through statute. The importance for those that do not work in the policy arena is that it's much easier to change policy in a rule than it is in statute. And so as things need to be adjusted, it's much easier when it's in the rule. The partnership has also worked to strengthen the school health advisory councils, what we call our SHACs. And they've been able to expand their scope to all components of coordinated school health, adding accountability through campus improvement plan requirements. I remember very fondly, I remember very well how they helped me when I was at the Department of State Health Services to help us secure funding for our obesity prevention initiatives. It's important when you're at a state agency that you're not the only voice. That is, you're asking for funding for an initiative, that you have other voices that are saying, yeah, this is really important. It makes sense. We need to move this forward. And the partnership was very helpful to us in that venue. And they were helpful in early childhood interagency council to establish it to study nutrition and physical activity in early child care settings, which will be important as we talk about this next legislative session. On the next slide, and I'll just go through the next slide very quickly. And if you go to our webpage for the partnership has been helpful, I think, to the media as they have looked for evidence related to different obesity initiatives. issues in the state of Texas. They've been a resource to them and have been quoted in articles. Here are just 3 of those that have been in the recent past useful to be were useful to, again, give an evidence-based approach to legislation and things that were occurring in the state of Texas. So we have a steering committee, which I have listed on the next slide. And in many ways, the steering committee is it's the volunteers that are willing and have time to help guide the work. We have over 50 entities that are part of the partnership. Obviously, a lot of them are dispersed across the state of Texas and so can't come to the meetings, the steering committee meetings. But this is a pretty active steering committee. During the legislative session, every Tuesday, we meet at the Capitol, have a room reserved to track legislation, figure out our strategy, try to figure out if we need to adapt. The steering committee works in the interim to select the priorities for the next legislative session, and again, to develop the evidence, the documents that will be used. And then we disseminate that to the other, about, again, 50 organizations that are part of the partnership. I would also note, as I look at the slide, that this is a very diverse group. You have organizations like the Texas Hospital Association, Texas Medical Association, Texas Pediatric Society that are very much in the healthcare delivery system. But you have also organizations that are involved in food, Feeding Texas. You have philanthropic organizations, Methodist Healthcare Ministries. You have organizations that are devoted to improving the care of kids, not only Texas Pediatric Society, but the Texas Cares for Children. You have organizations that are involved in schools, the Texas PTA, and the Texas Association for, and I'll mess this up sometimes, the Health and Physical Education and Dancing, TAFER there. American Heart, Diabetes. Again, the point is that it's a very diverse group of organizations trying to work together with one voice to address obesity in the state of Texas. So how do we do our work? On the next slide, there's really 3 components of what the partnership tries to do. First, we have to figure out what works. What does the evidence say is effective? And that's where Live Smart Texas is very helpful. We also work with state agencies, nonprofit organizations to try to sort out the different ideas and figure out what's evidence-based that would be effective here in the state of Texas. Now, after we figure that out, we try to set our priorities. And part of that is trying to figure out the history of different issues in the state of Texas, what is really palatable to the legislature, what is likely to be successful. We can't go into a session with 15 different priorities. It's just not manageable. So we try to get down to a limited list of priorities, usually about 5, that we will devote our time to during the legislative session. Part of that work is figuring out who will be sponsors, who on the Senate side, who on the House side will be our legislative sponsors for initiatives, trying to get bipartisan support for these issues prior to the session, try to get momentum prior to the session. And then once the session starts, following very closely the progress of the different bills, figuring out which has legs, which do we need to rethink, how do we reprioritize the issues, how do we read the environment and figure out how do we be successful during the legislative session on the variety of policy issues. So let's go to the next slide. And on this slide, I have the information from the previous legislative session. So before we talk about the 2019 session, I thought it'd be helpful to talk a little bit about the 2017 session and what did we learn and how we used that to reposition ourselves for the 2019 session. So on the right side, you have the one-pager document that we used during the session that laid out our 5 legislative priorities. And as we talk about this session, you'll see that there is crossover between these activities and the 2019 session. We think quality physical education is important. I'll talk more about that later. But having kids, when they are having physical ed, PE, and I say this as a parent who's seen my kids in good PE programs and poor PE programs, that there's a difference, and you can significantly increase the value of that time if you educate the teachers on what a good quality physical education program really looks like. During that session, we tried to have an initiative to improve the quality of food, the healthiness of food in state property vending machines. We also looked at creating a Vision Zero action plan for Texas, an initiative to recognize licensed out of school time providers who are above or beyond the minimum standards for healthy eating and physical activity, and tried to update child care minimum standards related to physical activity and nutrition. The bottom line during that session is that none of these initiatives went all the way through to become law. There were several of these that were moving, but there came a time during that session when a lot of bills were killed. There were things that delayed the passage of bills. And so the result was that during the 2017 session, we really didn't have any of our priority issues that really ended up becoming statute. But again, many of us have a very long-term view of how do we improve health in the state of Texas. And so we took the lessons learned from that session, figured out how we could tweak some of these issues, make them maybe more palatable to certain legislators. We also looked at the changing dynamics of the body, the legislative body, and used that to figure out what our priorities would be for the 2019 legislative session. So let's go to the next slide. So how do we strengthen our resolve and be more effective? Well, again, I think you have to start before the legislative session begins. And so on the left side, you have a document with some of the data that I went through earlier related to why obesity is such a critical health issue in the state of Texas. Put this together, not only the partnership, but the School of Public Health, Michael and Susan Dell Foundation, and state agencies, Department of State Health Services, and use this as a primer before the session to say, we really need to rethink what's happening related to policy and obesity in Texas. We used that then to develop our priorities for this session, the 86th session, which I will go over in the next slide. But again, having 2 companion documents of why it's important and what are we going to do about it in the state of Texas. So let's go to the next slide. So we ended up with 5 priorities going into the 86th legislative session, and I will go through these in detail and give you kind of a little bit of a play-by-play analysis of what happened in the next series of slides. But for each of these priorities, we made documents such as you see on the right side of your screen. And in each of these documents, tried to lay out the issue, a little bit of background, and then what a very precise recommendation for the legislature would be. And then on the right side, what the issue was at a glance with some data that they could take home. So the 5 priorities that we ended up focusing on this session were the following. First, we wanted to see how we could require school districts to institute recess policies that would allow children the opportunity to practice life skills and be active. We wanted to increase the quality of physical education in schools to ensure children are active and healthy and ready to learn. We wanted to establish the requirement for 1 semester of health education for high school graduation to ensure our youth are prepared to live a healthy life. Number 4 was to update the minimum standards for child care facilities for nutrition, active play, screen time to allow our kids, the smallest Texans, the opportunity to build a healthy life. And 5, to support legislation and policies at the state level that incentivize the purchase of healthy foods with SNAP, the Supplemental Nutrition Assistance Program. So this was our one-page flyer, and again, very succinctly laying out what our priorities are, a little bit about the partnership at the top. That is a coalition of over 50 organizations that focuses on obesity, and listed the logos for our steering committee at the bottom. Again, to give them on one sheet of paper who we are, what we believe should be priorities, and who the steering organization members are. So let's go through the next slides and talk about how each of these recommendations fared during the legislative session. Well, the first one was to look at recess policies for school. And we were successful in getting Representative Allen, Senator Watson to carry these bills. On the right, we have the information document that we provided to the legislature to support these 2 bills, noting that 20 minutes of recess per day is recommended, but only 73% of children get the daily recommended amount of physical activity. And we also noted at the bottom that districts that are high performing academically are 2 times more likely to have a written policy, recess policy, than lower performing schools. And again, in the document, I'm not going to read it to you, but tried to make the case that recess really is important. It's not just physical activity, it is learning how to cooperate, taking turns, how do you follow the rules, how do you work with other people and solve problems. And you don't necessarily learn that just in the classroom, you learn that during recess. And so not only the physical education component, but also the ability for kids to have a time to, during the day, just to unwind and figure out how do you work with other individuals. So what this bill would have done would be to require the Department of State Health Services, the SHACs, the School Health Advisory Committees, to develop model policies for the recess, and then require school districts to adopt a recess policy after they had reviewed that model. It wasn't to say that this is what you had to do, but the SHAC, the statewide SHAC, would develop model policies, and the school districts would then develop their own policy based on that model. But their policy would have to specify the required number of minutes of weekly unstructured play, and whether or not recess could be withheld as a form of discipline. This bill actually was passed by both the House and the Senate, and was done, it had a pretty overwhelming vote on both the House and the Senate. However, this statute was vetoed by the governor. And I'm going to read the rationale for the veto, because I think it's important as we think of the future of how do we move forward. He noted that he appreciated the good intentions behind House Bill 455, and there's no disputing the educational and health benefits of recess during the school day. But he notes that requiring the state and its school districts to churn out more policies and mandates about recess is just bureaucracy for the sake of bureaucracy's sake. So it's important, again, I think in that message, that he appreciates the intentions, doesn't dispute the value of recess, but wanted to think about a different way of addressing it. In response to Governor Abbott's veto, the partnership put a letter together that was delivered to the governor's office saying that we appreciated that he appreciates the value of recess, and that there's value there, and we would like to work with him in the future of figuring out how we could strengthen recess in the state of Texas and other health issues. Now, during the legislative session, there's a lot of curveballs that are thrown. And let me go to the next slide. Just to show you one of those, this bill actually was awarded the Bad Bill of the Week award by Representative Stickland. And again, these are some of the dynamics that occur when you're working in the policy arena at the Capitol. And let me again just read his quote. This is a bunch of pages about regulating recess, another unfunded mandate that's going to come into our local school and tell us what kind of equipment we're going to have. Do you want to play cowboys and Indians? That's racist. Do you want to play tetherball? That's too dangerous. What we need is local control. And so again, we had overwhelming support in both the House and the Senate, but I think it's important for us to understand some of the criticisms that does get thrown out there so that we are ready to respond to that during the session. Let's go to the next slide. Our second priority was to invest in quality physical education. Again, in our informatic document, noted that only 73% of 17 to 24-year-olds, noted that 73% of 17 to 24-year-olds are unfit for the military. Again, part of the rationale here, strategy, is that it's not just the health issues, but it's a military preparedness issue. We also noted that 73% of children do not get the daily recommended amount of physical activity, that over 80% increase in physical activity time during PE class. Let me rephrase this, that if you have quality PE and you teach the teachers how to really develop a quality physical education program, you can increase the amount of activity our kids receive by over 80%. And then the bottom item there is the return on investment, making an economic argument to address this issue. We had recommendations that you'll read at the bottom. Again, as we talk about how you have to pivot during a legislative session, the feedback that we were getting related to quality PE was that the recommendations that we had laid out really were not going to move forward. There really wasn't an appetite to increase the number of PE minutes from 135 to 150 per week. And so we changed our strategy to try to gain funding for teaching teachers related to quality physical education. We had some success. On the House side, there was a rider that was put in place that would have put $500,000 to make it available to TEA to provide grants to school districts for education of physical education teachers. We thought we were making progress in the Senate, but it ended up not being there, and it ended up in conference committee not being put into the final budget. And so again, some progress, some appetite after we switched our strategy, but we did not end up being successful in getting the additional funds. We did, if we go to the next slide, again, some additional attention as we tried to elevate this issue. We had a press conference related to the importance of physical activity. It was well attended. We had a former legislator who's also a former general, Rick Noriega, talk about the importance of military readiness and its link to obesity. Texas Senator Donna Campbell talked about the importance of physical activity. Deanna, Dr. Holschler isn't here today. You can see her hands barely in the picture. Talked again about the importance of this work. Tim Chower for our partnership, and Joe McMahon, again, trying to elevate this issue. But again, unfortunately, in the end, these funds for this initiative didn't get put into the final budget. Let's go to the next item. Our next priority was to try to restore health education. Again, I'm not going to read all the items on the one pager we provided, but basically since 2009, health education has been eliminated as a graduation requirement. However, there's a lot of direction the legislature has provided to schools to teach on certain programs such as CPR, healthy relationships, mental health, infectious disease, and there really isn't a venue to convey that information. And so we tried to make the case of restoring a 1 semester requirement for health education. But the bottom line is that this really didn't get momentum during the session. We could not get a sponsor for this initiative on either the House and the Senate side. And so it did not move forward. As we talk about interim charges, this is part of our thought process for the next session of how do we really elevate this and convey the importance of having that health education requirement. Let's go to the next slide. So we have better news for our last 2 initiatives. We had success with the, and we again remind you that in 2017 for this initiative we were not successful, but we rethought the strategy and got good sponsors on both the House and Senate side, and were successful in improving the standards for child care in the state of Texas. So we have, again, looking at the infographic, over 1 million kids in Texas are in licensed or regulated child care programs. The challenge is that sometimes when they're in those programs, the amount of TV time or the nutritional value of their food or the amount of activity that they receive can vary significantly. And so what this bill does is it aligns the minimum standards with the best practices from the American Academy of Pediatrics and also with the Department of Agriculture's child and adult food care programs. It doesn't mandate that they participate in those programs, but aligns the standards with those programs. One of the changes in the bill that occurred in order to get it across the finish line was that some child care facilities said that there would be a significant financial hardship upon them if they had to do this. And so there is a way for that to be waived, but only if the Health and Human Services Commission looks at the reason why, and they meet an alternative pathway to meet those requirements. This bill, again, was passed by both chambers and became law without the governor's signature. So then let's go to the last bill this session. And again, this one was successful. This bill, again, to remind you, is to create a SNAP, the SNAP incentive program to improve the availability of fresh Texas-grown fruits and vegetables to the recipients of SNAP in the state of Texas. There are federal dollars that are available. There's new under the Farm Bill, $250 million in federal funding that's on the table for these incentive programs. And this bill was designed to bring some of those dollars back to the state of Texas to benefit our kids and our recipients of SNAP in the state of Texas. So it allows the development, or requires the development of a pilot program, and allows HHSC to submit applications for federal funds and study what's going on in the state of Texas. And again, this will be funded by those federal funds that are brought to Texas. So on the next slide, part of the role during any session is looking at other legislation that the partnership can be supportive of, which I have on the left, but also figuring out where do you have to play defense for the successes of the past. And so one of those areas the partnership was supportive of was the Tobacco 21 initiative in the state of Texas. There was also an initiative that was unsuccessful to improve healthy food financing. There was one related to reporting the fitnessgram results to parents. It did not, it was passed by the House and not on the Senate. And a bill related to healthy food in corner stores, which again was not successful. On the defensive side, though, and again, as I just said, a lot of what occurs on the way the system is developed is to play defense. there was an initiative to repeal the fitness grant. The fitness grant was removed from those programs that were repealed. There was a series of bills to repeal the shacks and the overall shack requirement, and those initiatives were not successful. So again, success in playing defense during the session. So where do we go from here? Let's go to the next slide, and then the following slide real quickly. I think we have work to be prepared for the next session. Part of that work is to thank the legislators that were helpful to us. I have 5 here. Representative Tony Rose from Dallas, Representative Alma Allen from Houston, Representative Eddie Lucio from Brownsville. They were all very helpful in moving the initiatives from the partnership forward. Senator Kirk Watson and Senator Carol Alvarado also were champions. As I say that, and then again, I'm very grateful for the work that they did. We need to have more legislative champions. And so a lot of the work of the interim is to build additional friends that we need that will carry our initiatives forward. And we need additional bipartisan support. The individuals I have listed here are all on the Democratic side. This issue also resonates with Republicans, but we need to also cultivate them and help them become our champions going into the next legislative session. So in many ways, the success for the 87th legislative session, that groundwork is starting right now. And so as I noted, cultivating our legislative champions, but also right now is the time to submit interim charges to the legislature. And so for those of you who are less familiar, excuse me, my voice seems to be going away. But for those of you who are less familiar with the process, the Texas legislature meets every 2 years. In the year that we do not have a legislative session, the legislature meets and thinks through policy issues that they will be addressing the next legislative session. And so they meet publicly. You have a variety of people that testify on these issues. They put together plans, and then that is the foundation for successful legislation the subsequent session. And so the partnership over the summer has been putting their heads together to think through what are some of the strategies, ideas for interim charges. And I just want to go through some of those very quickly as I'm looking at the clock. I have a little bit of time left about what we're trying to do to be successful in the subsequent session. So let's go to the next slide. I noted at the very beginning how important Susan Combs' report was back in 2009. And we think it's time to revisit that report on the economic cost of obesity in the state of Texas, to identify the future costs on the state-funded programs and have many of those listed here in the safety net programs, but also look at the impact to Texas businesses due to absenteeism, healthcare costs, low productivity, and then to address strategies related to the cost of obesity in the next biennium's budget and over the next decade. Again, just trying to elevate this to an urgent issue, that there are significant costs related to healthcare, but also business costs, economic costs that the state of Texas is incurring because of the obesity epidemic in Texas, and to use that as a way to move, I guess, the agenda forward to address obesity in the state of Texas. The next slide. As I noted, we had some success related to physical activity and quality PE, but we didn't get them through across the finish line. So we're going to ask the legislature to study the quality, amount, and scope of physical education and physical activity students are receiving in school districts across the state. Examine the data collected by TEA as outlined by a bill that occurred in the 85th legislative session, and then to make recommendations on how do we improve access to moderate to vigorous physical activity while increasing academic performance in the classroom. Again, linking physical activity with academic performance, and how do we improve the quality of that physical activity that's occurring in schools across the state of Texas. And again, I'm not going to read the rationale, but it's the rationale we've been talking about, the burden of obesity in the state of Texas. And then we go to the final interim charge that we're submitting right now. And it goes back to that one semester of health education and that we do not have in the state of Texas, but that states are getting mandates to teach a variety of courses. And is there a better way to streamline and coordinate all health-related school activities and to identify venues within the school day to ensure students are receiving comprehensive skills-based health education to promote social and emotional health, prevent disease, decrease absenteeism, and reduce risky behavior? We do not know if any of these will be taken up by the legislature, but again, having an entity that has the voice of 50 entities, it raises the likelihood that some of these could be taken up by the legislature. And if so, there'll be a lot of work for us to do to make sure that those hearings are successful, that scientists like you that are made available to talk about the importance of these issues to the health of the state of Texas and to our kids, and come up with real policy recommendations that will be carried the next legislative session. So that in many ways links me into my next to the last slide of what we need to do in order to be successful in 2021. And we want to hear from you. We've set up a Twitter page that we can provide information on. We'd also ask you to sign up for emails from the coalition. And if your organization would like to be involved, again, this is a coalition of the willing, all that want to be part of this. We welcome your input and would ask you to provide that information. Another way that you can be involved is at the bottom. There was a very useful tool that many of us used this session that was brought to us by the Michael and Susan Dale Center that allowed us to follow legislation. And there's a little insert there at the bottom from a screenshot that shows the type of information where we could click on any bill, figure out where its status was, a brief description. And this is a tool you may want to follow the next legislative session so that you can be up to speed as much as we are related to the progress of a variety of bills. So with that, again, would welcome your input and your involvement. And I think we have a little bit of time for questions, and let me stop and see if we have any questions. Thank you.
Thank you so much, Dr. Lakey. That was a great presentation. If you have questions, please enter them into the question chat box in the webinar. It should be on the right-hand side, a panel on your computer screen. We have the first question here, Dr. Lakey. How do we communicate with our legislator about the interim charges?
So I think the local voice is always the most important voice. And so we can say things here in Austin to say these are important. But if you contact your own legislator to say, I heard the partnership had identified these 3 issues, and I agree that this is really important. And let me tell you a story about the challenges that we're having in our community related to obesity and trying to figure out how do we move forward in our schools. That's a really powerful voice to the legislator. And so if you don't know the member of the House, the member of the Senate for your jurisdiction, I would get to know them, and during this time period to say, send them a little message to say, you know, I work in this field. We really need to move forward, and here's some ideas to move forward. What we provide will go to the Speaker's office and the Lieutenant Governor's office. But if you can get your local legislator to be then your voice to say to the speaker and the lieutenant governor to say, I want that interim charge related to obesity. That is really powerful. Thank you.
In follow-up to that, Dr. Lakey, do you have advice on how they might communicate with the partnership if there's efforts? For example, you mentioned the importance of identifying these legislative champions. Is there a way that people can communicate with the partnership if they're interested in working with the partnership to identify one of their elected officials to be one of those champions?
Absolutely. And so I think it was on the second to the last slide. There's a little information there of how to contact us. The Partnership for a Healthy Texas. Send us your ideas if you have insights on a legislator that's interested in these issues. Let us know. Call us. We'd be happy to talk to you. And again, we need to have broad representation across the state of Texas and across political parties to address these issues, to get the kind of momentum we need. And so contact us and we'd be happy to work with you. Thank you.
Great. Okay, we have another question. Does federal funding determine where state money is prioritized?
Sometimes it does. So if there's ways to draw down federal dollars, or if there's ways to get federal dollars to pay for something in the state of Texas, it makes it easier to get legislation passed. And so, for those that aren't involved in how legislation works, you develop a bill, but then the LBB, the Legislative Budget Board, will develop a fiscal note for the bill. And the thing that kills bills is if there's a huge fiscal note. And so if you have a great idea, but the LBB says it's going to cost the state general revenue $2 million, it's not likely to pass. If, however, you can say, it's actually not going to cost us general revenue, it's going to cost federal dollars, we can draw down federal dollars to do this, it's much more likely that legislation will pass during the legislative session.
Okay. Just as a reminder to our listeners, if you have questions, please enter them into the chat box. Dr. Lakey, do you have any advice for those on the call who might be state employees as to how they can advocate for legislation without being worried that they're breaking the rules of their employment?
Yeah. No, I think that's a good question. And I am a state employee. And I can educate and I can provide data and I can say, give them the evidence base. This is what the CDC, this is what Trust for America's Health recommends that we do. But on my professional time, I cannot say I want this bill to be passed. So again, I walk that line. I provide oversight to the partnership. I chair, but I have to be very careful, as other state employees have to be, about going into a legislator's office and say, I want you to pass this bill. Now that's part of the beauty of the partnership, though, in that there are individuals that are part of this partnership that are paid to do that work. And they need the academic people, the people from the Department of State Health Services and other state agencies to help them figure out what they need to do. So we can, again, as educators, as scientists, provide that information. We can provide education. We can talk like I've talked today. But what I can't do is go into a senator's office and say, on my professional time, you need to pass Senate Bill 708. But again, you can work through the partnership and have your voice recognized. Does that make sense?
Yeah, and if they want to send an email or place a phone call from their personal email account, from their home computer, from their personal cell phone, they can advocate for specific bills, correct?
You can on your personal time. go in and say, I want this bill to move forward. You can do that from your personal home computer. Do not use your state computer to say, pass this bill. Right?
Okay.
You cannot lobby as a state employee.
All right.
On state time.
We've got two more questions here. Was there any merit to the argument that there is a cost involved in mandating recess, or that there were a lot of rules in the mandate for what kind of games are played? Are we fighting facts or just partisan fiction?
I think throughout the session, your work, there are myths, there's misinformation, and you have to confront it. The policy on recess, all it would have done was just have developed model policies and then have the local ISDs develop their policy. And so we do not believe there would be additional costs that would have been incurred. And it would not have done some of the things that some legislators said it did.
Okay. Then the next question, why was the provision of healthier school food not on the agenda this round?
I think the challenge just comes down to priorities. And if you have more than 5 for the partnership, it's hard to carry those, as you have to find a person on the Senate side and the House side that's going to carry that legislation. That doesn't mean the partnership isn't supportive of that type of legislation and can come in by the side and help and provide supporting testimony. But it comes down to bandwidth and trying to prioritize issues and figure out which are most likely to pass if we provide additional support.
Okay, great. Well, I see that we are at our time, so I'm going to go ahead and stop the Q&A phase of this webinar. Remember that the recorded version of the webinar will be available at msdcenter.org later after the recording session has ended and the staff has had time to process that. Thank you all for joining us today. And Dr. Lakey, thank you so much for your time and your explanation of the legislative session.
Thank you very much, and thank you for your participation. Sorry about my voice going away in the middle of it, but thank you all for being here today.
No problem. Thank you.
Mm-hmm.